Hi, my name is Noah Hayden, and today I'm going to be talking about improving access to healthcare. In 2020, a vast assault was perpetrated on our healthcare systems worldwide. The unprecedented medical challenges brought forth by the COVID-19 pandemic did demonstrate one future path forward for increasing access to healthcare: telehealth. Telehealth can be used to improve access for hard-to-reach communities and can reduce barriers to access for individuals seeking care. Today I'm going to discuss some pros and cons of implementing telehealth and how I think telehealth can help improve access to healthcare moving forward. What are some of these pros? Telehealth allows individuals access despite physical limitations. Doctor of Nurse Practice Jessica Pokowski and physician assistant Shelpi Gajarawala from the Mayo Clinic noted that telehealth improves access from rural communities and communities with limited physician reach. The American Medical Association noted that changes in rules around the provision and reimbursements during the pandemic increased use of telehealth. And according to physicians at the Mayo Clinic, this reduced cost and improved quality of care. Lastly, technology has made it possible for patients to track health data in real time and increased access to patient data for providers, according to an article in the Lancet's Global Health Journal. So what could possibly hamper the implementation of telehealth? Gajarawala and Pokowski argue that the greatest obstacle to increasing access to telehealth could be legal and regulatory hurdles. Many physicians and advanced care practitioners find that their licenses are limited by state and federal regulations. Also, technology such as telehealth requires access to technology resources such as smartphones and broadband internet. Broadband internet can be hard to provide to rural communities and can be hard to access in communities that are socially and economically disadvantaged. Also, the costs of wearables could be prohibitive and not covered by certain insurance providers. Given all of this, where do I see the future of telehealth? The pandemic made apparent the usefulness of telehealth. It also paved a path forward for increasing internet connectivity in our global day and age, as communication was realized to be essential. Also, rules around provider care are changing. The pandemic made it possible to change laws that enabled individuals to seek healthcare providers and set precedents for changing laws around telehealth that would increase telehealth provision in the future. Lastly, as technology improves, it becomes more cost-effective and affordable. Each year, wearables reduce in price and become more available to the public. Government programs are also utilized to increase access to technology such as smartphones and laptops in social and economically disadvantaged communities that can be used to improve access to healthcare. So, as I reach the end of my talk, it is critical to note that during a time when individuals were cautioned about social distancing to maintain health, telehealth was instrumental in improving healthcare quality and providing health resources to individuals who needed care. There will always be barriers to care, but it is important to move forward with laws and regulations that increase access to telehealth and improve telehealth structures in communities with limited resources. Telehealth is going to be a huge component of healthcare in the future, and we can make this happen. Thank you.